Hello, my name is Dr. Michael Nolan. I'm a cardiovascular surgeon at the Arkansas Heart Hospital in Little Rock. Some of you may know me as Taft Nolan. That's my middle name. I grew up in Dover, and I lived in Dover in the mid-70s to the late 80s. My parents still live on Linker Mountain. Things were a lot different then. There were no iPads or iPhones or Nintendo Switch. We played outside. We had an imagination. We played a lot of sports. My medical story starts in the 10th grade with high school football. The Dover Pirates were playing the Atkins Red Devils, and I was a receiver. I'd caught a pass and was running up the field, and I got tackled and I injured my knee. A few days later, I went to the doctor, a surgeon, and he told me I was going to have knee surgery. A few days later, I had knee surgery and spent about 3 or 4 days in the hospital. I was really impressed with the hospital setting, the nurses, physical therapists, especially the doctor. He was just very knowledgeable, and he used his education and talents to help somebody like me. This sparked my interest in medicine, and after I recovered from surgery, I asked him if I could shadow him and some of the other doctors. They always stressed to me the importance of studying hard and making good grades. I entered college at Arkansas Tech University in pre-med, and like a lot of freshman guys, we had a lot of fun that first semester. Brandon Hartman, Kevin Teeter, Aaron Wyatt, we all got a place together, spent a lot of time goofing off, staying up late, skipping class, and I really struggled to make good grades. I figured out at that point if I was going to get into med school, I was going to have to focus on school. So I became laser focused on making good grades. I knew I would have to develop some good study habits if I was going to make it through. It didn't come natural to me. I had to really work on it. And after 4 years of working my way through college and hard work, I was accepted to medical school. I was so happy to get in. I thought I'd really made it big. Then I realized I was going to have to really focus and work even harder. People would always ask me what I wanted to do to specialize in, maybe family practice or some type of primary care. There was a push to do primary care at that point, and they would actually pay for your school. But it was too early to really commit to anything, and all we were doing was bookwork and no clinical experience so far. We were in gross anatomy in the first semester. My partners and I were dissecting out the cadaver, and one of my partners said, "You know, you should be a surgeon." I was like, "Why?" He said, "Just look at the way that you dissected that out. You did it so quick and it looks really good." I've always been pretty good with my hands, playing guitar and playing piano growing up, and playing sports, having good hand-eye coordination. So they had a program called A Day with a Doctor that med students could go to in their first semester. I signed up to go to watch CV surgery, or cardiovascular surgery, with Dr. Williams. I called his office. They said he's got 3 hearts to do tomorrow. Show up at 7 o'clock. So I showed up, and it was just the most amazing thing I'd ever seen. He was cracking the chest open. They were pulling vein out of the leg. He was going on the heart-lung machine, stopping the heart, sewing on the bypasses, and then waking the heart back up and then closing everything up. That was the first time that I heard the name Cooley. A lot of the instruments that were used in the operation were named after Dr. Cooley. They were his instruments. It turns out that Dr. Williams had had students work for him in the past, and the students that were working for him were leaving that summer. And so I inquired about a job that summer, and I ended up working with him. I started clinical rotations, and I excelled because I'd already had hospital experience, especially in surgery rotations. When other students had to stand in the corner, I was helping with the operation, sewing up wounds, etc., because I'd had that experience. But I did know if I was going to be a heart surgeon, it was going to be a long road. 5 years of general surgery, and then 2 to 3 years of cardiovascular residency or fellowship. And at the time I was around 25 years old, and I thought, man, 8 more years, I'm going to be really old. I'm going to be 33 years old when I finish school. Looking back, I will never regret getting more education. So I finished med school. I passed board exams. I'm $125,000 in debt. I get accepted in general surgery at UAMS. In general surgery, you rotate through all the specialties: trauma, oncology, plastics, orthopedics, cardiac, breast. General surgery, you learn how to take care of really sick patients, trauma patients, do gallbladders, hernias, bowel resections, and remove cancers. A lot of long hours in the hospital, sometimes 100 to 120 hours a week. That was before they implemented the 80-hour work week. So you'd come in and work all day, be on call that night, spend all night working, then work all day the next day, go home, get 6 or so hours of sleep, and then get up and do it all again. So in my 4th year of general surgery residency, I started looking at cardiac surgery programs. I traveled to about 10 programs. At that time, it was pretty competitive. I got accepted for an interview at the Texas Heart Institute in Houston, and I interviewed with Dr. Denton Cooley. For some reason, he liked me. I think it was because I was just kind of a good old boy, good old Southern boy from a small town. I'd played sports, I'd worked my way through college and med school. I was driven, friendly, and I was good with my hands. So I was accepted to train in Houston. We also got to rotate through MD Anderson and Texas Children's Hospital. I spent a lot of time with Dr. Cooley. He made rounds every day in the ICU, and at that time he was doing surgery. Again, it was a lot of hard work, but I was so proud to be there training, and a lot of good memories and stories about Dr. Cooley. He's such an amazing person. So I finished my training with a plan of coming back to Little Rock to work at the Arkansas Heart Hospital in 2004. My interest is not only to do good heart surgery, as it had been done for a long time, but to make it less invasive. We started by doing endoscopic vein harvesting, which involves making a small incision in the leg instead of a long incision, so that the recovery is a lot better, a lot quicker, and a lot less pain. So after a few years, I started traveling around the country, learning new techniques for heart valve surgery. In about 2013, 2014, I started doing minimally invasive heart surgery. It involves making a small incision in the groin and a 2-inch incision in the chest, not cracking any ribs or bones. Surgery takes less time and the recovery is quicker. You get the benefits of having surgery without cracking the chest. I've done about 500 minimally invasive heart surgery cases, and I've been the busiest heart surgeon in the state for many years now. I've also discovered how much fun it is to have time off. My family and I enjoy going to the lake, to the beach, traveling around the country. In closing, I want to stress how important it is to get a good education, especially early on, because it lays the foundation for your later years in your career. At some point, I hope that we can all get together again in Dover. Man, that place has really changed. I'd love the opportunity to speak again and show some slides and videos of some of the stuff I'm doing to advance the practice of heart surgery, and to, of course, tell some funny stories. I hope you all have a good week and stay safe. Thank you.